Hello everyone, my name is Elvia Rodriguez and the following presentation is my needs assessment. The agenda for today includes the purpose of the needs assessment, data collection process, key findings and results, recommendations, dissemination, reflections. The purpose of the needs assessment. A needs assessment is a systemic way of gathering data and information to determine the needs of a particular group according to netting. The purpose of this assessment is to identify unmet needs for the targeted population of children ages 0 to 18 receiving mental health services in Tulare County in California. The main issues in children's mental health in Tulare County are the challenges and barriers to provide children with mental health services. The data collection. For the data collection, data was collected via interview, both in person and via phone, with 3 nonprofit agency administrators and program directors. The first agency was Dinuba Children's Services, located in Dinuba, California, with Denise Espinosa, which is an LCSW. She has been employed there for over 23 years. The second interview was with the program director of Visalia Youth Services, located in Visalia, California, Ivan Rodriguez, which is also a LCSW, employed there for over 15 years. And the third interview was conducted with the assistant program director at Sequoia Youth Services in Exeter, California. He has been employed there for over 17 years. The key findings and results. A few sample questions and results include what types of services do you provide children in mental health? The 3 agencies provided evidence-based practices in treatment, therapeutic services, crisis interventions, case management, and psychiatric services, as well as linkage and school advocacy, according to Espinosa. A following question was, what types of services and support do you provide for the families of children in mental health? We provide family therapy services, family rehabilitation services, and case management, as well as linkage services, according to Ortiz. The key findings and results continued. Additional questions were, has the number of clients versus number of employed professional ratio ever created an issue? According to Espinosa and Rodriguez, the answer was yes, we have experienced a high volume of overturn in the last few years, which created higher caseloads for current employees that were working there. Clients are not being seen as frequently due to the lack of employees in the overturn, creating also issues of extended wait times for initial intakes to begin mental health services and treatment. Okay. The additional questions were, what barriers do you find in providing mental health treatment in your community? One of the barriers that they found was transportation barrier due to agencies being in a rural location, the low socioeconomic status of the families that they treat, also limited rural public transportation being one of them. Another additional barrier would be the cultural competency of the service providers, which include language barriers. Some providers do not speak Spanish, which is the primary language here for these agencies. The limited service hours provided by agencies that do not meet families who are working. Those are barriers stated by Ortiz and Espinosa. Key findings and results continued. Again, what are challenges experienced in children's mental health? According to them, to Espinosa and Rodriguez, the stigma in children's mental health continues. That's challenging for them for clients to receive treatment. The recruiting staff to work in rural communities is also a challenge. The lack of parent participation and involvement in children's mental health as well. What are the strengths of children in mental health? According to Rodriguez, children's resiliency in meeting targeted goals, Children receiving services in primary language as well is another strength. Another question was, do you provide a number of services such as case management and therapy? Are there any additional services that this population needs? According to Ortiz, parenting programs and possible mental health screening for parents of children in mental health in order to be in good health for their children as well. Transportation for their clients to meet with the treatment team was one of the needs for Dinuba Children's Services, according to Espinosa. Recommendations for challenges. In terms of challenges with parents' involvement, implementing parenting program in conjunction with clients' mental health treatment, providing psychoeducation to reduce mental health stigma, thus increasing parent participation in children's treatment. Regarding challenges regarding employees to client ratio, to revise current recruitment systems and potentially increase job search engines, provide incentives for mental health professionals to work in rural communities as well. Additional recommendations for barriers would include hiring a transporter to provide clients and parents with transportation to attend scheduled appointments, explore to see if clients' medical insurances would be covered, would cover medical transportation as well. Recommendation for addressing cultural competency would be implementing late hours of agencies, for example, opening late a certain day of the week, or having extended hours to meet the family's needs, or doing weekend agency clinics. Okay, to share my findings of this assessment, I will be delivering via email a form of this presentation to the program directors and administrators who participate in the interview from Dinuba Children's Services, Visalia Youth Services, and Sequoia Youth Services.